Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The sensory profile assesses an individual's sensory processing patterns across various sensory modalities, including tactile, auditory, visual, vestibular, and proprioceptive systems. Its main purpose is to identify sensory processing dysfunctions that may impact daily activities, social participation, and adaptive behavior. The assessment aids in detecting conditions such as sensory modulation disorder, autism spectrum disorder, attention deficit hyperactivity disorder, and other neurodevelopmental disorders. It provides standardized data to guide clinical intervention and therapy planning. The tool is applicable to different age groups, facilitating a comprehensive evaluation of sensory integration and processing capabilities. The sensory profile is indicated primarily for children from birth to 14 years with suspected sensory processing difficulties. It is widely used in populations with neurodevelopmental disorders such as autism spectrum disorder, attention deficit hyperactivity disorder, and developmental coordination disorder. The tool is also relevant for children with cerebral palsy and other neurological impairments. Clinically, it assists occupational therapists, psychologists, and pediatricians in identifying individual sensory processing patterns. This facilitates tailored intervention plans and supports functional improvements in daily activities, academic performance, and social participation. Validity studies report internal consistency coefficients above 0.9, establishing reliability across diverse pediatric populations. The sensory profile assessment consists of 125 items designed to evaluate sensory processing patterns in daily life. Items consist of statements regarding the respondent's behaviors related to sensory experiences across various modalities such as auditory, visual, tactile, vestibular, and proprioceptive systems. Respondents use a 5-point Likert scale to rate the frequency of behaviors ranging from never to always. The assessment is completed by a caregiver or individual depending on the version used, typically requiring 20 to 30 minutes. Scoring involves summing raw scores across distinct sensory systems and behavioral sections. These raw scores are then compared to standardized normative data stratified by age groups to determine performance classified as typical, probable difference, or definite difference. Scores falling below the 5th percentile indicate definite sensory processing difficulties, while scores between the 5th and 25th percentiles denote probable differences warranting further clinical consideration. Interpretation guides clinicians in identifying sensory processing strengths and challenges, thereby assisting in tailored intervention planning. Sensitivity refers to the ability of a test to correctly identify individuals with a condition, representing the proportion of true positives. Specificity indicates the ability to correctly identify those without the condition, representing the proportion of true negatives. The sensory profile, a caregiver questionnaire assessing sensory processing patterns in children, has demonstrated variable sensitivity and specificity depending on the sensory domain and population studied. For example, studies indicate that the sensory profile sensitivity ranges from approximately 0.7 to 0.9 in detecting sensory processing disorders, meaning it correctly identifies 70 to 90% of affected individuals. Its specificity ranges from about 0.6 to 0.8, reflecting correct identification of 60 to 80% of unaffected children. In clinical practice, a high sensitivity ensures most children with sensory processing difficulties are flagged for further evaluation, while specificity limits the number of false positives, reducing unnecessary referrals. These values highlight the sensory profile's utility as a screening tool rather than a definitive diagnostic instrument. The sensory profile test was developed by Winnie Dunn in the early 1990s to provide a standardized measure of sensory processing patterns in children and adults. Its validity and reliability have been established through numerous studies involving diverse populations. Initial research by Dunn and colleagues demonstrated strong internal consistency, with Cronbach's alpha coefficients exceeding 0.9 in several sensory processing domains. Concurrent validity was supported by significant correlations with other established measures of sensory processing and occupational performance. Subsequent investigations have confirmed the test's construct validity by differentiating between typically developing individuals and those with sensory processing disorders or other clinical conditions, such as autism spectrum disorder and attention deficit hyperactivity disorder. Test-retest reliability has been reported with correlation coefficients ranging from 0.75 to 0.95 across sensory domains, indicating stable measurement over time. Furthermore, normative data collected from large samples of children and adults across diverse demographic groups have facilitated age-appropriate standardization, enhancing the test's clinical utility. The sensory profile's psychometric robustness and extensive empirical support have positioned it as a credible instrument within occupational therapy and related fields for assessing sensory processing patterns and informing intervention strategies. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.